Hi guys, welcome back. So we're talking about your back, trying to get you to have the best opportunity, helping you have the best opportunity to have a pain-free back, because that's what it's about, right? Quality of life. We've got to have good quality of life, not just in our athletic pursuits, but in our daily living activities, right? Everything we do. So one of the things I want to talk to you guys about are risk factors. What are some risk factors? We've talked about the fact that there's a lot of back injuries out there and there's a lot of money spent on it. So we want to avoid that. We've also talked about the common causes, muscle and ligament strain being the number one. We've also talked about the fact that back pain is non-specific. It does not discriminate. Anybody can have back pain. But what are the risk factors? What are some of the most important, or the primary risk factors, we would say? Number one is going to be your occupational hazards. And when we talk about occupational hazards, a lot of people are at work sitting for long periods of time. Or if they're not sitting, they're moving people, especially in healthcare. If you're having to transfer patients, or you have people in warehouses carrying and lifting heavy equipment and having to move boxes. So a lot of different places occupational hazards occur. Also, how about, I am saying this because I got a policeman in the audience today, in the room. What about at the police, when you guys are working out on the street? There's a lot of opportunity. Car accidents, car chases, and chase down someone, quick movements, also sudden movements. There's a lot of opportunity for back pain or back injury, right? So we want to help you prevent that. So number one, of course, like I said, occupational factors. Number two, which nobody in this room has to worry about, but it is a factor, is pregnancy. Josie will never have to worry about that until she's 40. Sean is definitely, and Charlie, her dad, is in the background laughing, going, yes, that is right. She's not even going to date till she's 35. So pregnancy, because a lot of pressure on that low back, because as your spine, as you're coming here and you're getting this excess or extra pressure right through this abdominal area, your back is being worked all the time. So what about a sedentary lifestyle? A lot of people think that if they exercise in the morning or they exercise at night, they're doing great. But they sit all day at work. My husband, he's a perfect example. I try to get him up and get him moving a lot more, and you just know how much he loves that. So we don't want to be exercising for 30 minutes once a day and then sitting the rest of the day. If you can, forget about if you can. There's no if. Just do it. Even we all have these smartphones. I set a reminder on my husband's smartphone, and the timer goes off to remind him that we need to get up, walk down the stairs, walk back up the stairs, and sit back down. Increase the blood flow. Remember, research has shown us that as we increase blood flow, it helps lubricate and stretch and lengthen the back, helps everything release tension. It's also going to help promote any healing because you're getting increased blood flow to the area. So we got to move. We can't be sedentary. Risk factor, poor physical fitness. That kind of goes with what we were talking about earlier, right? If we're not in good physical shape, we're not going to be able to take care of our bodies. As we get older, that's also a risk factor. Again, it doesn't discriminate, but it is more prevalent in our older ages or our older population. Here's one nobody ever wants to talk about. You go to your doctor, they're not going to say anything to you about this. Obesity and excess weight. When we're carrying excess weight, nobody wants to say this, but when we're carrying excess weight, especially in our stomach, it's like being pregnant. Because now you have got this, let's just say if the excess weight is not very conditioned, is it? So we've got this unconditioned weight in the front of our body, pulling our lumbar spine the whole time. Almost always, if you look at people who are carrying the excess weight here, you'll see that their belt line, wearing pants, you'll see a belt line kind of tips down and their hips tip up. Anybody ever notice that? Yeah, you've got that posterior tilt. Yeah. So you want to see that when this is happening, there is so much strain on the lower back, it never gets a break. The muscles are having to work 24/7 to support your spine because they're getting no help and no assistance from the abdominals. So healthy weight, decrease the risk of obesity, not only for your back, but for your whole general fitness. Strenuous exercises done with poor mechanics. This is another big risk factor. And this is where, especially with the younger kids, you're going to see more back injuries. I can't tell you how many times I have seen kids in their 20s, 30s, 50s as well, and above using weight so poorly, incorrectly, and throwing their back and moving around. And if you've ever worked out with me, you know what a stickler I am for form. I mean, I want everything to be structurally sound. So joint integrity 100% of the way, making sure that we're not putting that stress on the back. If you're using too much weight or you have poor technique in your fitness program, in your sporting activities, or at work, you're really going to put your back at risk for heightened injury. And it's really not worth it, is it? Why will we do something? If we're not going to do it right, why do it at all? We've always heard that. But if we're going to do something wrong and it's going to set us back, it's certainly not very productive, is it? Of course not. Genetic factors. Genetic affects another risk, and also people who have underlying existing conditions like arthritis and cancers. Those are going to be your primary risk factors for back pain. But Josie is going to help me show you a really great stretch today. We did already the bridges. Then yesterday we did the knee to chest. And today we're going to do a lower body rotational exercise where she's going to lay on the floor on her back. All right. Especially if you have arthritis or stenosis. This is something that's going to feel really good because it's going to help increase the flexibility and decrease the tension in your lower back. So as she sits here, if we can keep our knees and our feet together, that's absolutely perfect. If not, that's okay too. Her arms are going to be extended out to the side because she's going to very gently rock her knees over to one side as far as she comfortably can, keeping her shoulders flat. Now, if Josie is coming here, but her shoulder is up here, that's too far. I want to keep her down. All right? Very gently. She's not going to hold this for 2 to 3 seconds. Slowly bring yourself back to center and the other side. Again, shoulders are staying flat, 2 to 3 seconds, and she's going to do 10 times each direction. Now, if you're doing this stretch and you find it very difficult to bring yourself back into center, she can come to the side and one knee first, then the other knee, and back over. So one knee comes up first, and then to the center, and both knees go down. Wonderful. That's just going to decrease any extra stress on the low back if 2 knees at a time is too much. So again, 10 times each side, holding it for 2 to 3 seconds on the extension. Shoulders stay flat. How's that feel?
Feels really good.
Awesome job. Good job. All right. All right, guys, we will see you next time. Bye.